Welcome to the RAYCAN Alpha Plus training video and positioning for acquiring optimum 3D images. It is important to familiarize yourself with the various parts of the system. Included are the rotating unit, touch screen, easy positioning items such as bite stick, chin rest, temple supports and hand grips. Finally, the exposure trigger. The touchscreen selections include laser alignment lights button, up and down buttons, and the reset button. Set up the acquisition from within your imaging software. The first one you see is patient information including name and ID number. Once you click OK, this will cause the machine to initialize and moving to home position, making it more convenient for the patient to enter the unit. In the top of corner, you can choose the patient type from a child to a small, medium, and large adult. You will notice the defaulted to the medium adult. You also have the option to change the kV and milliamp settings if you decide. In the center, you have protocol options, which is important to note. All of the protocol will conduct visible X-ray guide button to extend the diameter up to 12 by 10 height. The default option is the standard protocol with a 300 micrometer resolution. To the right of that, is fast mode to review the anatomical structure, and also the estimated bone status after treatment in 5 seconds. The option to the right, gives the facial CT images. This protocol is being used for orthodontic treatment purpose with soft tissue information. Below the standard option, is teeth mode with 200 micrometers. By clicking the icon, you will have slightly different interface let you select the areas you are interested in. Also, you can choose either mandible or maxillary scan with single click. Next option, give the highest resolution at 70 micrometers with the same concept as previous. Right of that, is scanning a single unilateral TMJ 3D acquisition. Next option you choose scanning for 3D sinus. To the right of that, is airway. What this let you do is diagnosis of ENT treatment. And, finally with a guide icon, is 200 micrometers for model scanning. In the orange section, you can adjust the field of view with the remote easily. Also, you can turn on and off the positioning lasers. You can ready the unit or cancel out of this interface. Once you made the desired selections, you can click Ready to acquire the CT image. Prepare the patient. Ask a patient to remove the glasses, false teeth, jewelry, hair clips and pins. Place the protective lead apron over the patient's shoulders. Press the up, down buttons to adjust the height of the chin rest, so that it is slightly higher than the patient's chin. Ask the patient to step into the unit and grab all the hand grips. Ask the patient to rest his or her chin on the chin rest. Have a patient a couple of steps forward to create a slight tilt the spine position, ensuring shoulders clearance with the rotating unit. For mid-sagittal placement, verify the patient's head is not tilted to one side. For 3D scan horizontal placement, use the up and down buttons to bring the patient's occlusal plane parallel to the laser. And, ensure that the upper and lower margins of the field of view are where needed for the areas of interest. Carefully tight the head support, so that, they gently, but firmly grip the patient's head. Closing their eyes will help them remain still for the duration of the exposure. Ask the patient to swallow and remain still for the duration of the scan. Move at least 7 feet away from the unit and protect yourself from radiation. Press and hold down the exposure button for the duration of the exposure. For more information on proper positioning and usage of RAYCAN Alpha Plus, please consult the positioning guide. Thank you for watching how to take CT scans with RAYCAN Alpha Plus.